start, we've got some housekeeping we need to run through. Just to make you aware, we are recording the event today. This will be made available on the CCG website. And unless you're a board member or speaking, if you could keep your camera turned off and your microphone on mute, then we'll be able to hear and see the speaker clearly. We'll open the floor to questions at the end once we have heard from all our speakers. If you have a question to ask, please feel free to type this into the chat box. You'll find an icon that looks like a speech bubble at the top of your screen. If you click on that, it should give you the option to type in a question. Please mark who it's for if you know. Alternatively, you can raise your hand using the icon on your screen, which you've all become very adept at. We'll do our best to answer the questions as fully as we can. If we can't get through all the questions or it needs looking into, we'll come back to you with a written answer. Please email our comms team with your email address and question, and then we can send a response. We'll also respond to questions in writing if we do run out of time. So welcome to everyone, and this is our final annual review meeting as West Essex CCG. As you know, West Essex CCG is merging with Eastern North Herts and Herts Valley CCGs, and we will all come together to form the new ICS statutory body on April 22, as is happening across the whole of England. And we're preparing carefully for that big change. So this does mark a bit of an end of an era, but also the beginning of another one. And to get things going, we held a joint statutory annual general meeting in July, where we discussed the finances of that year together. But today we're going to focus on inspirational stories and work in West Essex CCG area to give you some flavour of what our staff have achieved and the services our patients have received. And without any further ado, I'm going to hand over to our chair, who's put a tie on specially, Rob Gurlis, who'll reflect back over the last 8 years or so, and then I'll come back to what we've done in the last 12 months. So handing over to you, Rob.
Super. Thank you very much, Peter, and thank you very much to everybody for their time this morning. And yes, I have put a tie on because this is quite a momentous time really for us. So I was reflecting on the last 9 years. 9 years because we, for those of us who were around long enough, we were in shadow for a year. And during that time, we actually had started public meetings. I think it was slightly frowned upon at that time. I think we weren't thought to be ready, but we felt we were ready. At that time, Claire Morris was our accountable officer, and she set us on the path to the integration. Was very, very keen to work closely with our colleagues in Essex County Council particularly. And to some extent, I think we were a little bit of ahead of the game in trying to get that true integration working. And it hasn't stopped. Dividing things up into how things have progressed. Strong local relationships. I don't know, for me, it's all about relationships. It was all about building relationships with everybody that we're working with within our community, within our population and beyond. And I think it's that we have been able to show strength and leadership and has got us into a good place so that we can deal with some of the turbulence that is coming, but also giving us opportunities to move forward. So strong relationships, particularly with our acute trust, Princess Alexandra. It hasn't been an easy time over the years for them. They've had a lot of changes in leadership and certainly a lot of problems with their site, position, size, and all the things that we know about. But despite that, have managed to sort of come through and are getting stronger, are able to look forward to a new development and hopefully a new hospital build, and people have heard about that. And they have been instrumental in building our development of our place-based care, which we call our One Healthcare Partnership, and they are an important part of that. Other parts of working with relationships, well, not least our citizens and our patients, the population we serve, they are an important part of our relationships and how we have developed and how we look to them for advice and the way that we move things forward, and not just advice, but actually getting involved in the decision making. We have had really strong relationships, as I said, with Essex County Council and with our strategic relationships with Hertfordshire, because of course we're now part of the West Essex and Hertfordshire integrated care system, and that is where we're heading post CCGs. We'd already started to form and had formed strong neighbourhood teams based around our general practice across West Essex, and that of course has morphed into the primary care networks that we see now. And for us, because we'd had that bedrock, because we'd already helped develop those teams in neighbourhoods, it wasn't a big step for us to then help to move towards what became the primary care networks. Clinically led transformation. The CCGs are called clinically led, and we've had a number of really good successes. Our Pathfinder projects, as we call them, particularly around musculoskeletal and respiratory and frailty, have transformed. Now, from a patient's point of view, they might not see that, but there is a much more seamless, it's not perfect, but a more seamless approach to how we deliver those particular services. And we're looking at other services now moving forward into making, again, some of that connection between primary care, secondary care, the community, and the social care work a lot smoother. We've had expert oversight groups, so these are clinicians and others working in various specialities to help facilitate that. And we've had 100-day challenges where we've tested new ways of working along the principle of, well, what if we could lift some of the rules? What if we could, what if some of this bureaucracy didn't exist? What could we do? And out of that, some changes are happening. So a lot happens behind the scenes. And hopefully some of that sort of filters through, so people see those changes. Other things, just looking back more recently, our response to COVID. Again, maybe we need to remember how we were able to set up, again, pretty efficiently and pretty quickly, our hot clinics. Now, that took a lot of planning, a lot of cooperation, a lot of coordination between all sorts of parts of our system. And although they weren't used hugely, thank goodness, they were there and they can be resurrected if need be. So, we've learned a lot from those. And of course, the vaccination centres, we were very quick off the mark to get those going, and our colleagues in primary care and the other centres, and Princess Alexandra, of course, got us well ahead with our vaccination numbers. Just quickly coming to the end, new GP practices. People probably do not realise how much effort and administrative and political, with a small p, effort it takes to sort of create new premises. But we've had the Lister House development, a really big and exciting new practice, very modern practice in Harlow, which has also given us the ability to have other things working out of that practice. And of course, it was our vaccination centre in Harlow, and the Crocus Centre which is our newest development, or the newest development in primary care in Saffron Walden. Two practices coming together using the old Saffron Walden Hospital site. So again, a really good use of our assets, premises assets being used. And Keats House. Keats House was a past new development, if you like, but again reorganising that, so we've got new services going to be working out of that, and the cardiology service from PH will be working out of that very shortly. So lots of good stuff happening there. I want to say a big thank you to our board. We've had an incredibly strong board right from the word go, and there are people who are still there, and I thank them greatly. We were also very keen to involve our district council and county council colleagues on our board from the word go. So along with our strong lay representation, who were our critical friends, who were questioning and just making sure that we were on track, I think that it's to them a lot is owed to our success. We've had a consultant from Addenbrooke's who has been a real critical friend as well, and public health, and of course our general practice reps who reorganised their professional lives to make sure that they were able to contribute to where we've got to. Last but not least, the quiz nights. I think probably our greatest success. No, it was something that was put together as we went virtual, and it was a good thing, and it was a way of bringing people together in a happy atmosphere. It wasn't designed to be team building; it was designed to be fun, and they will continue. So finally, I'd just like to say, as Peter said, it is our final celebration, as it were. It's been an honour and a pleasure to work at the West Essex CCG, let's move forward. And of course, West is best. Back to you, Peter.
Okay, thanks, Rob. As I continue to, just when I think I've managed all the tech and on top of my screens, something disappears. That's all part of our virtual world. It's back up, so I'm good. So thanks, Rob. You've given us this at the last 9 year view, and it's been really rewarding for me to be part of most of that. And I know West Essex has been an area that a lot of people chose to work in because of the culture that everyone's been a part of building and sustaining. It's a great place to work, and it's a very can-do environment. Very patient-centered environment, and I know that's something that we've worked hard, all of us, to hold on to and develop and grow, and will absolutely be something that we will continue and build on for the next stages that of where we evolve into. And just stepping back over the last 12 months, and it's difficult to try to do justice to everything that's been involved, because it's been such an extraordinary period the last 2 years, really, hasn't it, for everyone, personally, at home, and for our families, and all of the organisations who've been involved in health and social care. And of course, at the heart of it is, how do you provide basic services to patients during a time when infection control standards were completely different and changed and transformed the way that we were able, and our providers have been able to provide care. And of course, it's been very draining for lots of people that we've been involved with, and we have lost patients and staff during COVID because of COVID-19 and the infections that they caught, particularly in waves 1 and 2. And I know that has been really difficult for everyone that's been involved. Equally, there's huge things to have been proud of about the responses that we've been able to make to this really demanding situation, not least how quickly and efficiently the vaccination programme was rolled out, has been rolled out in West Essex, and it was, West Essex in particular, and I know some of the practices, and Ian's going to talk about this a bit later, were some of the really early movers and getting those vaccines out early, which will have saved lives, so the older and most vulnerable people, driving around to people's homes, getting those vaccines out and safely to patients, and that has brought us to where we are now, which is a so much more, still very challenging, but so much more stable position than where we were at the beginning of that outbreak, not quite knowing how we were going to manage this new disease that we're facing. We've got a huge thank you for the nursing quality team who sort of worked tirelessly to help teams manage these infection control standards, and also not least in care homes who've had a really challenging time, but also the outbreak management. So when the outbreaks have happened, there's lots of meetings I know have been led by the quality team to manage those outbreaks. It's completely on a different level to what we've had to manage before, and a huge thank you to those teams. Rob was going to talk a bit later on about the way that primary care has had to work differently and digitally, and that digital way of working has been completely different, that we've asked patients and practices to work, and actually accelerated some of the transformation we'd wanted to do, that's enabled us to bring to the benefit of patients. I think the other big theme that's been part of the last 12-24 months has been mental health demand, and not just for people with long-term serious mental illness, but also the general impact on the population flowing from employment challenges and some of the isolation challenges. Equally, I remember Jen West, one of our GPs, on camera now, telling us how actually some patients found this the time at home and away from some of the buzz that we have of general life was the benefit of being at home, and that's it was a mixed picture, but certainly as we've emerged through the outbreak and through the COVID pandemic, we are seeing substantial extra demand presenting for young people and adults in the community in our hospitals. Now, fortunately, that has coincided with a transformation program that was already underway, and in particular, both for young people and adults. But something I'd like to draw attention to is that for mothers, we've been putting in a perinatal support program targeted for mums at greatest risk and families to help them at the time of the birth in the first 12 months, because that can be such a trigger for lifelong mental health problems. And I know that's been an important service that has started during the pandemic that the EPUT have set up. And as a CCG team, we've had to work completely differently and virtually, and we've had staff briefings. We've been able to actually probably communicate better through this medium rather than cramming everybody into a room. But it's meant that the finance team have had to do the accounts virtually for the first time, and everything that's involved with that, and all those connections and closing down, that's been very challenging. And our transformation program, it can be really difficult to be doing transformation during a time when all of the operational work is drawing people's attention. Yet there's been a very different way to running outpatients that's during this pandemic that's been set up. The amount of virtual face-to-face work that has been set up with colleagues, and the minor eye conditions enhanced service, and that approach for opticians treating many more people in the community, which really helps the busiest outpatient department in the hospital to manage staff, manage patients, because of the way that minor eye service and all of those community changes were made, that the transformation team have absolutely led, and is now spreading across the ICS as a model. And we've also had primary care network aligned teams, as Rob's described. Our neighbourhood's been quite, we set those up as a CCG, and the transformation team have been supporting each of the primary care networks to help work with EPUT and our social care teams, both mental health and community services, to align professionals and voluntary sector staff to each of the GPs to help with connecting in different ways and more efficient ways than we've been able to do in the past. And then I've consciously ended with this because it has occupied all of our time. Operationally, in terms of during the pandemic, the support that our team have had to give to PAH and other providers is outstanding. It really is, in terms of in hours, out of hours, being on call. Lots of people have been on call during it, but there's particularly want to say a huge thank you to the ops team who have been on many really challenging calls, and it's calling for support from other hospitals or asking the community trust if they can discharge patients, and all of that detail. But it's not just doing it for one day, for 1 week, 1 month. It's been doing it continuously throughout this period, and a huge thank you to the staff who've been involved with that, and anyone who's been involved on call, because I know how draining it is, but also how rewarding it is for everyone who's been involved with that, to have that support and support colleagues during what's been an incredibly challenging time. I also want to just draw attention to what's been unusual with regards to refugees and asylum seekers. So as you recall, in Epping, we had a new centre, and we have had no time to plan for these things. And our ability to respond through the local resilience work with our county colleagues and police colleagues has been outstanding again, and huge thank you to everyone who's been involved with that to get primary care services in place in Epping, and to support what have been quite vulnerable adults and families arriving in the UK. And of course, that actually prepared some of the systems to help what we've seen most recently with people from Afghanistan, and more widely general quarantine support, where we've had to put healthcare services around to support residents arriving in Stansted. And again, some of those families, adults, been through some really challenging circumstances, and the Stansted practice in particular really came forward and did some outstanding work with the wider community. But as ever, this is a team effort. And I think we need to, thank the people in the CCG who have and our part in coordinating, and because it's members of CCG staff who need to sort of blow the whistle and get all of this organised, that can be so demanding and so draining on time and effort, whilst all of the other business is going on. And of course, most recently, it's also in Harlow. So all three of our districts have had to find ways to support the arrivals to the community. And of course, if that wasn't enough, guess what? We've been doing it during a period of transition where we've been thinking about merging, building towards merging the CCGs. So we set up a new executive across the three CCGs, and building on all the strengths, hopefully, across our two areas. And we've got some new ways of working with Hearts colleagues to try to bring the benefits of a bigger system to the whole. We've been meeting in common as three CCG boards, which I think it can be challenging having. Thank goodness it's online, having 70 people online. Imagine that in a meeting room, to get that to be as productive as we can. And of course, not only that, but halfway through this process, we weren't even sure what our boundary is going to be. We reopened the question, we're asked to reopen the question, were we going to Essex or weren't we, or we're going back to Essex County, or were we going to stay with Hearts and West Essex? So you couldn't really have created more turbulence than we've been through, I think, in the last 12 months. It's been demanding on us all, and to all of our collective credit, I think, about how we've had to work our way through that, taking a step at a time. And my huge thank you to all the staff of the CCG for your contribution to that. We're going to come to look ahead later, but I just want to close with my section, just talking about the One Healthcare Partnership, which again has been a critical issue for us with regards to bringing our local partners together, and I think continuing this West Essex culture of joint working, and is a key platform for us for the future. And so whilst the last 2 years have been incredibly challenging, we've seen a lot of positive outcomes as a result of closer working and engagement. And to help illustrate some of the work that's been going on behind the scenes, we'd just like to share some stories with you. And to start with, we'd like to play a short audio from Amy, a mental health ambassador from West Essex, who's spoken briefly of her experience with mental health services for young people during this time. Then we'll hear from Renee Roby from Health Watch Essex, and then Nyasha from Nelft, who will tell us a bit about the pathways that Amy has been taken along her journey. So I will look to Vanessa to help us with the technical side at this point. Thank you.
That's fine. We'll go to Renee, and she'll be able to introduce Amy.
Fantastic, thank you. Do we have the slides for this, please?
Yeah, just going to get those up for you.
Thank you. Amazing, thank you so much. So as a quick introduction, my name's Renee Roby and I'm an engagement officer at Health Watch Essex. I look after a group of volunteers called the Young Mental Health Ambassadors, and they're a really fantastic group of young people, all of whom have experience of accessing local mental health services. So our ambassadors are from all throughout Essex, and we are commissioned by the West Essex CCG. So we currently have 26 ambassadors, both male and female, and they're all part of this really great programme called Young Mental Health Ambassadors. And the background to this is that the Emotional Wellbeing and Mental Health Service was due to undergo re-procurement. OWS really wanted to make sure that the voice of its service users were included in this process. And this was to ensure that services were designed and delivered in the right way, and it would be most suitable for the young people who would actually be using the services. The Ambassador Programme was created to recruit, train and support young people, all of whom have an experience of accessing these services. And it also provided them with the opportunity to become more involved by sharing their views and their own personal experiences. So our youngest ambassador is actually 11 and our eldest is 23, although we do go up to 25 if they are 10. So can we go to the next slide, please? So these are just a small list of some of the great organisations that the ambassadors have worked with. As you can see, there's quite a range from Enable East to Essex County Council. In regards to Prince Alexandra Hospital, this was a really great partnership. So the PAH had a newly established Children's and Young People's Board, and until relatively recently, it was solely formed out of professionals. The board came to the ambassadors and they said that they'd really like to hear their voices about what they should be looking at next. So they held focus groups with our West Essex ambassadors and also attended our monthly meetings to hear from them. Obviously, our ambassadors are very passionate about mental health, and it was fantastic because the board recognised that maybe this was an area that they hadn't looked at in as much detail as other areas. Following this, I'm actually really pleased to say that 2 of our ambassadors are now co-chairs on this board. As you can see here, we also have Mind. So we've worked with a lot of the Mind organisations within Essex, but we've worked especially closely with Mind in West Essex. Back on, I believe it might have been the 4th of February, it was Time to Talk Day. And the theme for this year was Power of Small. Our young people shared real life stories of when something small had a really big positive impact on their mental health. And this was shared across the Mind in West Essex Hub social media pages. So this included Facebook, Instagram and Twitter. It was also picked up by the main social media pages of Mind in West Essex as well. Mind, sort of the National Time to Change programme was also coming to an end. For the last 10 years, they've been looking at stigma and discrimination, and they wanted to know what their focus should be on for the upcoming years. So they approached our ambassadors within this area and asked them what their ideas was. They had an awful lot of them. It's something they're really passionate about. And some of the key ones that came out of this was mental health support for people living with LD. Separately, there's also mental health support for young people living with addiction. And the one which is most passionate, and it's come up throughout the whole time that I've known them, was the mental health support that's available in schools. So this is also colleges, universities, or any kind of educational institution. So they're really pleased because we've done a lot of work with mental health support teams as well. But they said that although it's always been quite an idea that they're very passionate about, since COVID, it's really brought it to the forefront, and they thought that this was an area which could be a focus for Mind in West Essex. Some of the work that we do is also brought to our attention by the ambassadors themselves. Obviously, the last coming up to 2 years, the theme has very much been around COVID. Then the young people shared that in their friendship groups, they've been having so many more open conversations about their mental health. They said that it was a really good time to try and reach out to young people and see what their views were and their personal experiences. Following this, we actually co-designed a survey with the young people themselves, and the ambassadors went out to their friends, their schoolmates, young relatives, and we managed to get 116 participants, which was completely and utterly unexpected. We held an online Zoom event following the collection of the surveys, and this was attended by the Multi-Schools Council, OOMS and Mind Trailblazers as well. In this session, it allowed the young people to have the opportunity to sort of go into more detail about the information they'd collected, and also to share their own personal experiences as well. Following both the survey collection and the Zoom online event, we created a report, and it was called YMHA Discussions, the Impact of COVID on Mental Health. In this report, we put forward recommendations that the young people have found out. And the one which I thought was it was really great was the recommendation that mental health organisations utilise social media and online platforms to reach out to young people. They said especially during COVID, there wasn't really anything else to do, so they spent a lot of their time on social media. They said by putting out sponsored ads, it's sort of reaching out to young people who might not be in a position to reach out to organisations themselves. They said if there was sponsored ads talking about symptoms of mental health, and also where to go if some of the young people recognise it in either themselves or other young people around them. If we can go on to the next slide, please. Fantastic, thank you. So following on the conversation about their passion for mental health, it was Children's Mental Health Week and the theme was Express Yourself. So as we recognise that the young people are very passionate about mental health, we did a social media takeover over our Health Watch Essex social media platforms. So this logo here was actually designed by an ambassador herself. We have a private Facebook group, and she posted on there and asked the other young people what they wanted to put forward, and puzzle pieces was the most popular response. When asked about this, they said it was because puzzle pieces is what you see a lot within sort of children's mental health imagery, And also they said it sent out a message that not one size fits all, and you may have to try a few different options before you find a service that suits you. Next slide, please. So as the theme for Children's Mental Health Week was Express Yourself, we said to the young people, in whatever format they would like, they could share their views on mental health and also their own personal experiences that felt comfortable with it. These are just a small snippet of what they did. I'm so sorry, this is it's quite small, but this is a screenshot of one of their blogs. And our ambassador, he shared his top 3 tips when dealing with stress. We also had daily motivational quotes that were sent out on our social media platforms daily, and these were submitted by the ambassadors. Next to this, we have this image of a lady, and this was drawn by one of our ambassadors who's studying graphic design at university. She's really passionate about body positivity. So she drew this post, and also we shared a link alongside this of her own blog that she's got like on a separate website. So she does that alongside the ambassador program. And here we have this lovely little fella called Clyde. So Clyde is a therapy animal, and he belongs to our youngest ambassador. She lives in Harlow and she's only 11, and Clyde was bought for her as a therapy animal. And she said that when she feels angry or upset, her rabbit calms her down. Whenever we have monthly meetings, she always has Clyde with her as well, which is always a pleasant feature. Next slide, please. So one of the formats which a few of the ambassadors went for was like audio recordings or video recordings. So Amy's from West Essex, she's only 19, and she did a really fantastic audio recording. This audio recording was looking back as a reflection of her time during COVID. So if we can play this, please. Fantastic. So that's Amy's story. I actually spoke to her a couple of days ago, and she was really chuffed that this was being shared with you. She said that at the time of this recording, she was seeing a really great counsellor, and said the reason why this counsellor was so great was that they didn't restrict her to hour time appointments. If she went over the appointment, it didn't matter, she could carry on talking. She had regular medication reviews with her psychiatrist. And this was an area which worried her, so she felt like it was being kept on top of because the appointments were so frequent. Amy actually shared that a few months after this was recorded, she started having hallucinations, but she spoke to her counsellor, she spoke to her psychiatrist, and said it was dealt with in a really quick and efficient way. And I'm really pleased to say that Amy's doing really well. But what I'm going to do is I'm going to just quickly pass over to Nyasha, who's going to go through the mental health pathways.
Hi, everyone. So just a little bit about myself. My name is Nyasha Gobekile, and I'm the operations manager for the crisis service for Essex and Thurrock. So I think just echoing on what Peter was saying about, I think the impact of COVID across mental health services, we definitely felt it, and we're still feeling it. I think we're not over the hump yet. But I think one of the things that we had to do as a service was adapt to the needs of COVID. For example, we couldn't go into A&E as much as we wanted to, obviously, because of the restrictions in A&E. So one of the main things we did was we opened a 24-hour hub, and that was based more in Stapleford House. And what that enabled was we could divert patients and the parents out of A&E. So instead of them going into A&E, they'd phone us. We do a phone kind of review, assessment. And if they didn't need to go into A&E for anything physical, health related, like self-harming, we'd send them through to the hub and assess them. So this has still been one of the things we're doing up till now. And that's just in recognition of the fact that A&E is still quite busy and still feeling quite overwhelmed. Working with PAH has been quite interesting because they've really allowed us to put most of these measures into place. I'm sure some of you commissioners have already been called quite a few times over the last few months in relation to escalation calls because of children being stuck in A&E and not being able to move on because of the closure of NHS beds. So that's another area that we're still dealing with. But I think with the way that we've changed our community packages, we're now offering community packages where we try and divert some of these children who would normally have gone into tier 4 beds to manage them in the community with a more of an intense 2-week, 4-week to 12-week program. So there's things that we're putting in place in the community with the help of the CCG, obviously. And I think the GPs will attest to this. They're getting a lot of pathway emails from us, and they're getting a lot of flow charts detailing how we're going to be working and how we're changing how we work. Sorry. So one of the things that I would just like to say is it's a pity we didn't get to hear Amy's story, because Amy actually talks about the kind of journey that she went through, and I would have been able to point out the places that we would have come in and supported her. And one of the things that we're doing is we're also using a lot of online resources, just in recognition of the fact that children have had to go online for a lot of the support that they needed. So this is again another way of trying to mitigate the need for face-to-face appointments if they're not required. We are still seeing a lot of young people face-to-face, and we are continuing with that. And I think, as you know, with COVID still peaking in some areas, we are still going to be seeing as many children face-to-face as we can, because one of the feedback that we got from the children is a face-to-face appointment is much more effective in most cases than an online one. Just to echo one more thing, we've seen an increase in children with ASD and LD presenting over the pandemic. And I think anyone who's worked with those children with those kind of diagnoses understands that they would struggle with change. And because of the changes that they've been experiencing, we've had to adapt how we see them as well. I could go on forever, but I know that we're on a tight schedule. So if I've left anything out, I'm sorry. But just to say that hopefully we'll continue working the same way with the new incoming service that you're coming into. Thank you.
Great. Thanks to Nyasha and Renee, and I know with you mentioned the ASD diagnosis. I know we did commission some additional diagnostic capacity as well, because I hope, because there has been a backlog in trying to diagnose presentations. So hopefully that may partly be contributing, Nyasha, why you're seeing some more people with those diagnoses. So I think that's been really helpful to hear those stories and give us that focus on the young people's point of view. And you know, I've sort of written down about dancing in the rain. I think I might use that again. I found that really helpful as from that slide that you showed, Renee. And I wonder if you do have any questions for Renee and Nyasha, then do please raise those on the sidebar. We can pick those up towards the end. So I think next on our agenda, I'm going to, and Vanessa will pick me up if I'm wrong on this, but you hold me to task, going to COVID vaccination program and Ian. Is that correct?
Yep, that's right.
Ian.
Hello everybody. Good afternoon. It is afternoon, isn't it? 12:42. Yeah, my name's Ian Tompkins, Corporate Services, West Essex CCG. For Kaylee, can you kindly load up the slides, please? That's okay. I just wanted to give everybody an overview of where we are at in terms of the vaccination programme. This has been, or is, because it's continuing, the biggest single vaccination programme of its type in the history of the NHS, I think, and been going for some months now. Fakir, if you could go to the next slide, please. So here we go. Feel like a bit like children in need, really. So we've done 408 28,798 vaccinations in West Essex so far, which is an amazing achievement, I think. As you'll see on the screen there, we've got over 200,000 have had the first dose, 198,000 nearly have had the second, and work continues to encourage those that haven't yet had the jab, and I'll come to that in a minute, also with the boosters. Next slide, please. So here in West Essex, you'll see we have had a number of clinics. Many of them are still operating in various forms, and I think it's time to take the opportunity really to thank all those that have been involved in running those clinics. So that's our colleagues from the primary care networks, Hearts Community Trust, which have been running the Harlow Leisure Zone Vaccination Centre. But I'd also like to thank the many volunteers that we've had as well, that have been out there in a lot of rain during the summer, if we had a summer, and wind like today, and doing a sterling job, just making everybody feel welcome. And the majority of people I've seen come out have had their vaccination and come out with a smile, and I think that's what it's about. It's putting that smile on people's faces. I'd also like to thank the venue hosts. We've been using various places, car parks, community centres and so forth. I'd like to thank those. And last but by no means least, our own CCG staff, who behind the scenes have been working around the clock. People like Jenny Knight and Yolanda, dashing here and there 7 days a week, putting up notices and generally organising things and so forth. And without them, we would not really be where we are now. Many of the walk-in clinics are for people who want their first or second dose, and those are still active now. And we've also moved, as you will have seen, started moving into the booster jab, which is 6 months after the date of your second jab. So here at St Margaret's today, we've got Deepa and the team from the PCN here are doing those, and there's people going in and out, been going in and out all morning. And at the same time, where we can, this gradual introduction is the flu jab as well. So there's an opportunity for some, if we can do it, that want it, to have both jabs at the same time. And you will have seen there's also a considerable programme now being launched in schools. In Essex, that's by and large being run by our colleagues in ePut. Next slide, please. So engagement continues on all of this, as I say, to working closely with the councils to share correct information. There's a lot of information out there you may have heard about, a lot of kind of myths about the vaccination, but also, and more importantly perhaps, a number of genuine concerns or worries that people have. So we've been doing all we can with our local authority friends to create understanding and allay any fears and so on. And I just wanted to thank the district councils particularly for their part in that. I think I call it the COVID legacy, provides an opportunity with so many people thinking about health, but also coming into our vaccination centres, as we put it, to make every contact count, as we do in the retail world. What opportunities do days present for cross-selling or upselling important health information, health MOTs, and information about cancer prevention and so on. So we're working closely with Essex County Council, particularly at the moment, in developing a programme to maximise those contacts that we are having with people, many of whom very rarely, fortunately, don't need health and care services. So it's a great opportunity to get some long-term prevention messages across to them. We're also building close relationships with community groups across the area. And I think, again, part of that COVID legacy has brought many of us together that wouldn't have otherwise have made contact. We're having regular virtual events, including some with local colleges, Epping Forest, the Debden College we've been to recently. We've also had events with Harlow College and so on. And we also have a new website with an updated list of clinics, myhealthessex.co.uk. lists all the clinics as and when they're happening over the coming weeks. Tackling health inequalities is also part of that legacy, that opportunity. We have been working with people, particularly in areas where we have had lower uptake than other parts of the patch, and we've been laying on additional clinics in Waltham Abbey, Loughton, bits of Chigwell, and of course Harlow. We've offered information in different languages and formats, but importantly as well, I think we've had regular meetings with key groups to review what's needed. One such group being the Harlow Faith and Communities group, and I see Neela there. Big thanks to Neela, because she's very supportive and done an awful lot in getting those people together to keep them up to date, and for us an opportunity to understand any concerns people have and how we can better support them. And then also finally, obviously it's not just about West Essex, it's a multi-agency working across borders, and we've been working closely with our neighbours in Hertfordshire. I should also mention our very own Peter Boylan, who has been working at a vaccination centre in Bishop Stortford, thanks to Peter. And also we've been obviously engaging with the rest of Essex and also North East London. So I think, you know, it has been an interesting project to work on. The biggest vaccination programme of its type in NHS history. There's a lot to celebrate, and obviously, as I said, I think, you know, ultimately it's about making people safe, but in so doing, putting smiles on their faces for the experience that they've had. That's it from me. Thank you.
Thanks, Ian. And obviously thanks to yourself, because I know you've kind of thought about nothing but vaccinations, you know, amongst many other things. And for every patient you vaccinated, you're always aware of the next patient you haven't vaccinated, and trying to find a way to get that message across. So a big thank you for everything you've done and the teams that you've worked with. So as we know, primary care has been on the front line and very much in handling this, and it's often in the national press around people trying to approach their practice. And Rob's just going to give a primary care perspective, I think, on what it's been like providing primary care services at a GP end. So Rob, to you. You're just on mute.
That's another few quid in the box. Okay, right. Sorry about that. Yes, thank you, Peter, and thank you, Ian. Yeah, general practice. I mean, like we've heard that the whole system during this period, and we're talking about the hospitals, community, the councils, the whole system of our health and wellbeing has been under enormous strain and has faced enormous challenges, and general practice is no exception to that. And we recognise how difficult that's been for the practices and also for the patients. But we have to put some of that into context that GPs were instructed to change how the patients were seen by NHS England. COVID-19 is still here, and we need to be mindful of that. And extremely vulnerable patients are seen in general practice, and therefore it's a different environment to the Tesco's and the other supermarkets that people might go to. And I think, again, we need to just bear that in mind. And the practices have a duty to keep their patients safe. But on the other hand, we need to find that balance, don't we, between the virtual environment, which we've moved to in a very, very quick way, but also getting back within those confines of infection control guidance, face-to-face where needed. And that is what we're doing, and we're doing that in conjunction with our GP practices and the PCNs, and our primary healthcare teams within the CCG are also working really hard to sort of get that balance right. And while we recognise all that, we know we're not there yet. I want to share with you a good news story, because there are good news stories out there. One of our practices, and that's our practice in the High Street in Epping, the Epping Surgery. It's one of the first practices to have a CQC inspection once they started re-inspecting again. They'd stopped during the pandemic, the CQC, and previous to that, that practice actually was in a requires improvement category. So the CCG went in, and there were virtual interviews, clinical searches, a site visit. So you know, CQC doing their job as they should, and the outcome, cutting a long story short, was they moved from a requires improvement to good. And there are a number of things that the CQC commented on during that period, which was about how the practice had, you know, tried really hard to maintain continuity with patient centered focus, even during a time when, remember, a lot of patient staff, practice staff, and this occurred, were going into isolation. So, you know, a lot of practices are running on their staffing levels, and there is a very little in the way of backup when practice staff go off sick or isolate. The CQC also had said that the practice adjusted to the way they delivered their needs to their patients. And an example they gave was the use of an as required area to see COVID symptomatic patients in the courtyard. So they were fortunate enough, it doesn't happen in every area, of course, you know, from the footprint of practices, but they had a small courtyard, and they were able to, if you like, sort of have perceived high risk patients seen in another setting, and maintaining the sort of staff and patient safety. So it is good, and there is good news out there. We know we're not there yet, and we're still working with our practice, and I think you'll see over the next few weeks and months that those changes sort of having real impact. But again, happy to take questions and comments later on in the question time. Thanks, Peter.
Great. Thanks very much, Rob. And yes, it's been a busy time in primary care, and thanks to the primary care team for all the support they've given to Epping High Street and all of the other practices in responding to the different challenges that they've been facing. And finally, one of the big achievements of the CCG in the last year has been how staff and partners have worked closely with the community. And this began in earnest with last year's flu vaccination programme, followed closely by the COVID vaccination programme that Ian's described. And this is now evolving into engagement on other areas of health, social care and wellbeing. And we're really pleased to welcome Neela Hibbert to the meeting. And Neela runs the Harlow Ethnic Minority Umbrella, which represents around 24 different ethnic groups in the town. And Neela's here to tell us about how engagement between the CCG and the community has played a part in her community. So welcome, Neela, and over to you. You're just on mute,
Neela.
We've all been there.
Oh, sorry, Neela, we can't hear you. Neela. Oh, sorry. No, there's sometimes a delay. It's saying you're muted.
No, can't hear you yet.
Let me see if I can unmute you.
Yes, can you hear me now?
We can hear you now.
Perfect.
Thank you, Neela. Perfect.
Right, we have got 29 faith and cultural groups that we work with. Just to let you know, in last September, October time, I was panicking a little bit because there was so much information in social media about anti-vax situation. There was so much saying that, you know, this is not a sort of good vaccination to have, and BME community were panicking, and the pastors and the faith and cultural groups were constantly contacting me and asking me what we could do. And I sent an email to Rainbow Services saying, please, Gemma, can you get in touch with Ian? We need to have vital meetings to discuss how best we can link up with the groups and the West Essex CCG team to understand and explain and overcome their fears about these vaccination. And we had regular meetings, and I'm sincerely very grateful for the West Essex CCG team, Ian Tomlinson, Lauren, Dr. Bob Gurley's, and you know, I don't think we would have had 90% vaccination rate among the BME community in Harlow if not for their regular meetings. I was in such a panic mood. I calmed down by the third meeting because they were constantly asking about the AstraZeneca vaccination and the Pfizer vaccination, they were saying to me, what are your thoughts of the possible side effects of the yellow card? And so we asked Dr. Rob Gurley's, and he went through all of the side effects and explained things so clearly to the people that they were so confident enough to go and have the vaccination. And it got to a stage where people are coming and saying to me, where is the vaccination? And they knew, they were that keen to go and have the vaccination. Even the elderly among the BME community were quite interested. And I have a really fascinating story to tell you. An elderly lady, initially, the doctors said that she couldn't have the vaccination, but when she could, she went and had the vaccination. Initially, she said to me, you know what, I don't go out. I said, look, you are living in a multi-generation household. You have got your grandchildren going to school. You have got your son going to school, coming home. Your daughter-in-law going to school, going to work and coming home. And they can transport the vaccination. They can bring that vaccination to home, and you can get COVID. So she went and got herself vaccinated, and she had the second vaccination, and she did get COVID, and she was very ill in hospital. And they even told the family that she's not going to recover. And 2 days later, I get a phone call. My mom has recovered. She has spoken to us over the phone and told us, this is a Bangladeshi family. Please don't forget to do some samosas and onion bhajis for the nurses. They've been very good. And the daughter was crying to me because the mother couldn't even say a word before. And she says, I knew then my mother was coming home. And then, and all of these positive things that was happening encouraged more people to go and get themselves vaccinated. But then we have still got 10% that's very fearful, and we are working on them. And I'm so sincerely very grateful for Essex CCG for being at the side of us when I was in such a panic mode. And thank you, Ian, and thank you, Dr. Bob Gurley's and Lauren, all of you, all of the team. Well done. We survived. We survived the Atlantis. I couldn't tell you how hard our team worked. Honestly, we were just night and day for 7 days a week for the last 8 months. So it's been super busy. And I thank you sincerely from the bottom of my heart for all the help you've given us.
Neela, it's been
Great.
a pleasure working with you, and you're doing an amazing job behind the scenes. And now you're not behind the scenes. I think that in itself is testament to what you're doing. There are other groups out there as well. I mean, the young persons group and the college, really important. They have very similar questions, and I think what that one-to-one environment just helps, doesn't it? And then you spread the word, and it gives people confidence. That's the main thing. So thank you, Neela, for all you do.
Thank you.
Thanks, Neela. And the other thought that's going through my mind, ever looking forward, was there must be some lessons that from this and about how we've worked together that for all of the other vaccination screening programs, where we're trying to get out to every member of our community to be saying, have you thought about having the X screening and do you know how to, and what's concerning you, and here's what to do next, and so there's all of the benefit that you've helped to bring. I think there's so much more that we can do, particularly in Harlow, I think, where we do find how to contact with such a diverse community that you can bring some of that expertise and contacts. So thank you so much, and I know we really look forward to working with you and the Health Watch team and everyone community facing for the future.
Peter, can I just also a little shout out as well for Dr. Visu Shiko from Princess Alexandra, a consultant who's really a consultant microbiologist, really busy, has managed to either attend, or if she hasn't attended, she's contributed with some, really sort of, consultant-led background stuff, which we were able to share. So again, that just adds weight. So a real big thank you to Shiko.
Great, thank you. Thanks very much, Neela. And so at this part of the meeting now, we've got open for questions really. So if there's anything that anyone would like to raise on anything, or any other shout outs or comments that that you'd like to raise, then this is some open time that we put on the agenda. And I'd look to Vanessa to see if there's anything that you've wanted to pick up so far. I can't see anything in the text bar at the moment.
We haven't had any questions come through, so if anybody does have any questions, then feel free to put your camera on and ask it, or type it in the chat and we can read it out for you.
Okay, we'll just give that a second or two. Okay, well that's easy, isn't it? That's let us off the hook. Here we go, Jen. Well done.
Mine isn't a question. Mine is a compliment for you, Peter, because you have been, whenever I've seen you, unfailingly positive and upbeat. And it must be really difficult sometimes. Some days you must be wanting to bang your head and our heads off the wall. But that's not what I've ever seen in a meeting. So thank you.
Thanks, Jen. That's very kind. And I know the senior management team that we've met twice a week actually throughout of this process, and I get a lot of sort of strength and support from that team, because that you can lean on so many people, and we've been very, just as the board's been very consistent through our time. The same with the senior management team. We've stuck together. So I do, but thank you for that kind comment, and I know I'd extend that to my colleagues and from them, and Rob also, who, as you know, is an amazingly kind of calm, always smiling, positive sense of support that for me personally is there, and I know the staff hugely respect that you're very present as a chair, Rob, in the work and that you've done, not just during COVID and the quizzes, but also throughout the 8 years, and the way that you personally led this and helped this organisation become what it's become. So I think it is important to step back and just say those, give those thank yous, I think, isn't it?
Well, that's very kind. But I don't think this would be self-congratulatory. One thing I think, just to remind ourselves, our staff at the CCG. So we're talking about the whole team. It's not a huge team. We're not a huge organisation, but everyone in that team, everybody plays a part. It all means something. And Peter, I would echo what Jen has said. You've brought in some really helpful things. One of the big advantages of going virtual was our staff meetings. They have been transformed. We used to all crowd, if people remember, crowding into the, our small boardroom, really, and then people felt a little bit intimidated because we're on top of each other, but now it's blossomed, and people are telling us what they do, and it's made it so much of a difference. And something which we probably ought to just mention, we buck the trends, although we're not perfect, and we know in our patient survey has areas which we need to address. We buck the trend, certainly in our region, where our response for our patient survey during the pandemic actually was really had gone up, had improved, and there was a great deal of positivity. And I think that's a big testament to you. It's generally a staff survey. The staff survey, yeah. So I echo that, Jen. So thanks for that.
Thank you. So
I think we need a tricky question from Stephen or David or Peter, but this is pleasant. That's good.
So Louise.
Afternoon, amazing hour. Thank you very much for this. I think we all needed, as you say, take time out, take stock, reflect on all the hard work we've done over the last 18 months and before. It has been a tough time for a lot of people, I think, just adjusting to the new ways of working, the pressures and strains of work, and just trying to, as you say, deliver the quality that we're all known for reputationally. So thank you very much for this. I think one of those, or Rob, you did ask for a difficult question. It's not how well West Ham's going to do this year. It's more where are we looking over the next 6 months? And I think, where do you think our focus should be as a CCG, just for the staff here? What are the things that we should be looking out for as we, not in our daily work, but also just generally where the CCG is going, and obviously some of those mergers with the rest of the ICS by April.
Right, shall I kick off, Peter, and then you can come and chip in and correct me. So I don't think our strategy has changed, Louise. Actually, it is about place now. Now, place might mean something very slightly different. CCGs don't exist. We've always known, for example, that parts of East and North Herts, the Stork Valley practices, Bishop Stortford, Sawbridge Worthies practices, actually fall very much within our remit, if you like, of how we work, and may very well be part of our place at some point in the future. But we've been developing our One Healthcare partnership, working with the Acute Trust, working with the community, working with the county councils, working much closer with the districts. And I think we still need to just bring the districts in a far greater way. And I think we're in a place where we can do that. Epping Forest are certainly a very go ahead in that. Harlow has recently, there's been a change in the way that they work. So there's a lot of opportunity here to address the social side of things. But so what's our One Healthcare partnership and developing that, and let's see where that goes, and does that become an organisation in the future? May very well do. But we're on the same path. The ICS effectively will be a strategic oversight to keep, to set the strategy, which is not going to be any different to what we've already known, and just making sure that that there's a coordination where it works, where it works well to work across with our partners in Hertfordshire. Then it makes sense to do that. But we equally will be looking to Essex as well, not least for the children's and mental health. So steady as she goes, but with some opportunities, I guess, might be the précis of that. Peter?
Yes, thanks. And I think if I sort of look internally first, I suppose is part of the answer is that this is a time of transition, so there is uncertainty, and some bits we can answer, some bits I think we'll just have to wait for it to unfold. But I think at the end of the day, it's in the context that the challenges are as great as ever, and the skill set that we have and the teams and the relationships that we have are remarkably similar to what we need after April 22. And so it's about keeping that continuity and during that. It's dancing in the rain of the transition, isn't it? There is that challenge for us as we move from one type of organisation to another, and reaching out to your opposite numbers in Hertfordshire, because there'll be problems that we've solved that we can sort of help. The minor eye conditions being a really good example. There'll be other things. I think they're really good at some diabetes stuff they've done at Herts Valley that we can be perhaps learning and bringing into our community. And then I think also we've got to keep outward focus with regards to our communities and what their experience is, because we've got people coming off furlough. We've got this is an interesting, challenging time. There's no. It's whilst we're coming out of the COVID pandemic, we're going into another type of challenging period of economic uncertainty, and I think we need to keep connected to that to understand what it is that the community needs and where our services need to adapt, because I think it continues to be an unusual period in the next 6 to 12 months. I think we've just seen it with food. If it's fuel, there's all kinds of differences and challenges that we're going to need to navigate. So I think we've got to keep looking out and see how it develops, because it's quite an uncertain period, and of course, and supporting each other and not expecting to know the answer to everything or be able to solve everything. It's adding value where you can, isn't it? And letting others lead where that's in place, and bringing other people in. And it's been really useful to listen to our to have colleagues from NELF talking today, and from members of the community, and from Health Watch. It's together, isn't it, that where we've been most successful working together. So that would be my answer to that question. But a good one to put us on the spot with. Thanks, Louise. Okay.
I was going to say no, thank you, Peter, for the well-rounded answer. It's not an easy one, and I think there's sometimes strength in not always having the answers, but saying openly this is what we do know, this is what we don't know, but we'll help answer those for you as staff and our community over the next 12 months to help us all, as you say, ride this new wave of change that's coming our way. So I think that's quite strong in itself. But thank you for answering that.
Thanks, Louise. Okay, so Neela.
Just to say, there is also the long COVID situation that we have. And so that's also another challenge for us because we do not know what the outcome is going to be. Quite a lot of the people, and that's also a concern for us because those are questions that's been asked. And I mean, we always keep saying to people, to avoid long COVID, please get your vaccination because that's the only option you have, rather than get long COVID and then, get COVID and then sort of keeps coming back and going and then suffer. And that's the exact words that we've been saying to people, because if you have the vaccination, there are various strands of COVID, but at least you will have a full recovery.
And that's good to hear that if that's on people's minds, we need to find a way to respond to it. And about the long COVID question, and it's challenging to know, and people better qualified than me would know when is long COVID and when are you in a sort of a post-viral state or whatever the correct term is. But it's important, and I think I'd come back to my previous point. There are equally as many important aspects of other aspects of people's health that relates to lifestyle and the way helping people look after themselves is so important to get really great habits going forward. And I think working with our community leaders to help get those messages out and support people and the challenges they face, whether it be long COVID or a newly diagnosed long-term condition. And we're aware for practices in particular, they've got a lot of, they're working through their backlog of all the routine checks they do that is so important for helping people. But we do have, as you probably know, a long COVID service that is available and resourced the local area. So certainly we would be able to help connect people to that where it's suitable. If there are specific questions that in that respect. Stephen. Sorry, Neela.
Just the most important thing is you have got link workers, the social prescribers in GP practices. They have been absolutely brilliant. Honestly, they have endlessly worked. I mean, that's a marvelous service, and I must say, and it needs to continue because they do a hell of a lot of work with us as well. So I'm sincerely very grateful that they're there.
Great, thank you, Stephen.
Yeah, so first introduce myself. I'm Stephen King, and I've been a board member since we started, and I'm incredibly proud of the team that we've worked with, and I'm incredibly proud of the team that we've got. So I thank all of you, both board members and staff, and I shall really remember this time with a lot of pleasure. And I've been in and around the NHS for a long time. But I want to just give a quick shout out for a hidden team of people who often don't appear. And you may know that I am involved in the urgent care services in another part of the country. The people who man the 111 teams and the ambulance services, and their lives have also been transformed. It has been enormously stressful for them. The volumes of inquiries from the public, both overnight and weekends, which is the traditional time that these services kick in, but now 24/365. It has been transformed. So a big shout out for those people who are behind the scenes in this area. It's Huck who provide the 111 service and the out of hours and the East of England ambulance teams who have been really under pressure. So we don't often talk about them. I don't think we really think about them enough in terms of our planning and how we integrate all of that, because for us as the public, sometimes we just want some reassurance, sometimes we want some access, and sometimes we want to vent our frustration, and sometimes we're looking for some urgent help, and they've also played a huge part. So a big shout out for them as well. So thank you.
Absolutely, Stephen. Thank you. No, and critical. It's when we think of the quantity of calls that are handled by both of those services, and for people at really pressured points in their in their life, and we've had I know the urgent teams helping trying to release crews back out onto the to go out because they've ended up being stuck at the trust, and we've had crews into new roles. Cohorting, looking after 4 or 5 patients before they've been able to get into the ED assessment process, because we've had those sorts of backlogs, and it's a challenging time. But also interesting seeing paramedics going into primary care, and I've been part of that frontline response for patients, and bringing that skill set and that sense of calm that often paramedics bring, isn't it? There's just experts in there walking into a crisis situation and bringing, as many mental health professionals are, bringing a sense of order and calm to what can be really challenging. Thanks, Stephen.
Yeah, no, absolutely, Stephen, and thank you for bringing a balance, because I just think sometimes we concentrate too much on the things that aren't going right, and on the bad things, and on the poor service, and perhaps some people, not doing what they're meant to be doing. But actually, the vast majority are working incredibly hard and are doing it, and we kind of take it for granted a little bit. So I think sometimes redressing the balance is important. So thanks for that.
Okay. Well, thanks. So just conscious of time ticking on, I just wanted to say a couple of sort of things looking forward. Then I'll am I handing it back to Rob to close, or I'll just look forward first of all. I think as we were starting to say, there's a number of challenges that still remain, and that can be in the community regarding employment. It can be our staff's resilience and the vacancy rates that we have, and it can be building confidence amongst the community to get back to self-care, which is so important, as well as all the waiting lists and the extra demand that we hear about. And I think there are 2 main sort of organisational changes that we've got. Will be coming the integrated care system, probably called the Integrated Care Board. We'll wait for that to be finalised, and I think it'll be important to watch for that. And we've, as our group of partners that are involved in One Healthcare Partnership, which is West Essex, Princess Alexandra Hospital, our 3 local councils, EPUT and voluntary sector colleagues, we're putting together a strategy about, well, looking forward, what is it the things we want to achieve for our community, and prioritise as we go ahead. And we'll have a similar session to this, I think, in Vanessa, won't we, to communicate that strategy, that together, what is it that we want to focus on, from starting well for children, living well, being well, through to the end of people's lives, and how people die well, and which is as an important component of our total service. So that as a strategy that we'll be bringing forward, and the CCG and our staff and our GP practices have worked really hard, I think, with the refugee position, and we'll be keeping that under close review, because it's really difficult to predict, and I think one thing we can predict is we can't predict it, and we've had the resilience teams. I think we can expect that they will need to continue to respond to unknown situations, because this goes beyond UK, doesn't it, and are on standby for that. And I think it's a sort of closing message from me is to say that there's, and we know we have said already, and I know Jen has a hand up, but a big thank you to staff who've been involved with the CCG and our partners. And whilst the organisational names and badges will be changing, a lot of the people and all of us, we hope, will not be changing. It's us who are leading together and changing things together with those same sense of purpose and action plans. And let's keep this show running. And we look back, it's really good to step back and look over the last 8 years to think all of the things that we've been involved with, and there's no reason to believe that the next 8 years looking forward isn't going to be just as exciting, working together for people of West Essex. So thank you for today, and I'm going to hand over to Jen, and then perhaps to Rob for a final word. But Jen, I know you've raised your hand.
Yes, brief comment. There's a lot of people out there who are not in this call who are absolutely exhausted. They're weary, they're worn down. They're so worn down that they don't know what to do next. And we all know them. But they're actually too tired to put their hands up and say, look, I'm fed up. And I just wonder whether each of us on this call could think of somebody we know. It doesn't need to be somebody who's in a pitch, just needs to be somebody you send a message to. And I've done it a bit over the past year. And you're just sending a message to somebody saying, I've just been out for a walk today, the leaves are blowing in the wind, and been on a holiday recently, and how are you? And I've had some really good conversations out of it. And some folks I'm messaging quite regularly. Others, apologies if you're on the call and I haven't messaged you recently, but but I think it's just that reaching out. You were talking about resilience, Peter, and you can't be resilient in a vacuum. We just need that connection. And I can't connect with everybody. None of us can connect with everybody. And it only takes a couple of sentences, just something warm out your heart to share with somebody. You might not get an answer, or you might get an answer saying, I'm just so glad somebody messaged me. You know, I've had an awful day. It was nice to hear something positive. I'm looking forward to going home to the dog tonight. That's the kind of messages I've been getting back. And I think it just makes a difference to folks. So there we are. I don't know how many are in the call now. There's about 30 of us, I think. So wouldn't it be lovely if 30, 60, 90 people in the CCG just got an upbeat message in the next few days? Challenge for you folks.
Yeah, nice one, Jen. Thank you. One of the things we hadn't said was there have been some other things that we put in the mindfulness groups. So we have recognised that people are under a lot of pressure. But you're right. Let's all keep in contact. I just want to thank everybody. I guess maybe just echoing what we heard at the beginning from our presentation, and as Peter said, I think we probably ought to get out there dancing in the rain right now. So look, thank you everybody. The show will go on, and it does go on, and we're still here until at the end of March. So business as usual, or better actually. So thank you very much everyone. Have a good afternoon, and we will all catch up soon. Good. Thank you very much.